Hi, this is Shivan from MedicMind. I'm going to go through a live walkthrough of an MMI station on personality and skills. The station brief is to talk to the interviewer about your skills and to discuss what skills make a good doctor. I'm going to watch this on my iPad with you and give you my commentary of what I can see.
Hi there, welcome to MMI Station 15. And this one's on your personality. Have you had a read of the briefing?
Yes, I have.
Okay, brilliant. So we're going to talk a little bit about how you work in teams and as a leader as well. So could you give me an example of a time you've worked in a team?
So I am a dancer and I mainly dance in groups.
Okay.
So that would be my example.
Okay.
And as a dancer you have to be very aware of what other people are good at and what you're good at compared to other people, so yeah, you kind of make a balance.
Okay, so one thing I've noted straight away from this candidate is they don't seem to have prepared this answer very well. They seem to be stuttering quite a bit at the beginning and almost trying to find out in their head what example they can give. So one thing that I would say for a question like this is always have a prepared answer and always have a prepared activity or skill that you can always describe. She also mentioned that you have to be aware of what people are good at and what good dancers are, but she's not being very specific again. So just make sure that you're being specific in your answers and you're explaining why this is important to the interviewer.
And you don't do things that someone else is maybe better than you at and things like that. Okay,
brilliant. So how do you link that onto medicine? How do you think the skills of teamwork you applied in dance could extrapolate to medicine?
So I would say, so as in medicine you have to work with a number of different people, and you have to do that in dance, and I would say sort of playing, you can use it to play to your strengths, and that you can, maybe asking for help if you need help, asking someone else to do something for you if you know that they can do a better job, but also helping someone if they need help.
So one thing I've noticed with this candidate is that they're just moving on to separate points very quickly. Instead, what she should be doing is actually focusing on one point and actually describing it in a bit more detail to the interviewer.
And those sort of things.
Okay, so from your work experience, can you give an example of when you've seen a medical team working?
So I did my work experience in obstetrics and gynecology, and when so I was in the ultrasound scanning room and I saw a registrar learning to scan.
So again, this candidate stutters quite a bit at the beginning. Maybe they should just be a bit more authoritative in the sense that at the beginning of their answer, they should say that, yes, I did see team members working together in my work experience. And this is something that really stuck in my head during my work experience because they worked together well, they communicated well, and they also communicated to the patients well. So in summary, I think this candidate really needs to focus on maybe taking a deep breath, just pausing for a few seconds before they start answering the question, rather than kind of umming and ahhing at the beginning.
And the consultant was observing and just making sure that she was doing the right thing, helping her with that. And then there was, at the same time, there was also a nurse there sort of asking questions to the patient, so it made it quite efficient. Okay.
So my final comment on this answer is that it's actually quite a difficult answer to follow. Answers are kind of floating around everywhere. She's moving from one point to another. So again, a really nice way to go about answering your question is using the STAR, or even with the F, the STARRF technique. So situation, task, action, result, reflection, and then future as well. So if you try and have a bit of a structure to your answer, it will just make it so much easier for the interviewer to follow. Thanks for watching this video. Click below to subscribe and catch more of our videos. To watch our full online course and find out how you can enroll onto our award-winning program with personalised one-to-one tutoring, online weekly webinars and more, click here.